And March 28th in the year of 2020. Continuing on, uh, some more stuff about County Hospital, the San Bernardino County Hospital. Uh, Worked there a number of years. There were a few things that happened, some of it kind of comical, some of it kind of scary, some of it kind of weird. I'll just go down the list here that I made to continue on with the antics. So the normal address for nursing personnel, nurses would wear a white dress and had their tag on and all. The respiratory therapist, for whatever reason, of course, most nurses were female, but if a guy was in there practicing as LPN or RN, they would wear white slacks, white shirt, and usually a kind of a little light white smock over on top of that. Respiratory therapy, though, they decided, you know what, just wear some nice street clothes, button-down shirt, tie, slacks, pressed, clean shoes, no tennis shoes. And how that came about, I don't know, but that's what was active at the time there. So with the necktie, you know, it's kind of weird because we'd lean over patients and the tie would be getting in and stuff, and I go, it just doesn't seem sanitary. And I didn't want to confront anybody out of just being feared I'd be looked upon as a troublemaker. But one day up on one of the floors, and I guess this was like another floor where they had patients that were uh, um, mentally challenged, and so maybe kind of a psych ward. But I go in. I'd never visited this patient before, and I went in either to check oxygen or breathing treatment. I can't remember what. All I can remember was he was a huge man, uh, probably very tall, about approaching 7 foot. And he looked at me, reached out and grabbed me by the tie and swung me around the room. And about one swing, and I got away. And I left the room and I said, that patient is a violent patient, and I will not be seeing that man. He swung me around my neck by my necktie around the room once, and so I got out of there. Well, the reason I remember now, they had sent me down there. They said, and I hear all kinds of commotion. They go down. They say, Mr. Such and Such, he's tearing up his room, and I'm the only dude up there. Go down there and see if you can get him to stop. And the bed was turned over. Yeah, I'm remembering it all a little better now. And I go in there and immediately buy the tie, and he gives me a swing around the room. So yeah, I stopped wearing a necktie after that. And when I explained why, it stood. No problem. You don't have to wear a tie. Gosh, kind of up on the same floor. I remember this third floor was just always a problem. So apparently it was where they were putting, people that weren't quite correct. And this woman just takes off running down the hallway, and I'm watching her. I'm figuring there's really no place for her to go. And she hits the exit door, which seems like to me it should be locked. And she goes out, and there's just like this little 4 foot barrier. There's a little podium to before the stairs start off to the side, and she just over the edge 3 stories down. That was that. um, there was a incident where a man had got in an auto accident and apparently had run into like this fence, and it had these little about a 3 or 4 inch treated post for the railing, and it went through the windshield, went through him, and basically through the back seat. I mean, the back of his seat. Now it had a blunt end because when they brought him in, he's still alive and he's struggling to breathe. Of course, he wasn't a happy man, and I mean, they brought him in from the ambulance. They couldn't lay him down because he had posts sticking out of his back. So he walks in, and apparently this blunt post was able to just kind of push aside long major vessels and stuff. Broke a few ribs front and back. And the next thing they're doing, they're sending him to the surgery and calling for anybody that has a chainsaw. If you have one nearby, go and get it. So someone went and got a chainsaw, please, because they had to cut off the backside of that post so they could get them laid down so that they could start extricating the rest of that post. I wish I could have been in there to see that one. Yeah. And then there in San Bernardino, there's a little town of Colton. It's very a lot of gangland type stuff going on between the primarily Hispanic against Hispanic. You just formed your little tribes, I guess, however that works, and you catch somebody in your territory, and you're not going to be nice to them, type of deal. And this young man was brought in by ambulance, and he had been drugged behind a car. They put around a rope around this guy's, like this, and then drug him behind the car. And it, oh my gosh, I mean, he was scarred. I mean, just skin and even probably muscle just torn away. And so he ends up he recovers. It took a long time. He spent a long time in the burn ward. That's where they treated him because they're going to have to do all kinds of uh, tissue donation type stuff, and it takes months, for a burn patient or somebody that's been drugged like that and has lost skin and whatever. And he eventually got out there, got discharged months and months, later. Don't go dragging behind a car, either doing that to somebody or letting that happen to you. It's not good. He went, he was gone like a good 6 months, and he ended up getting drug again, and his tissues hadn't even healed again. So I mean, it was brutal, brutal. Here we go again. Um, some of the got to go down into the cellar of the hospital. The director of respiratory therapist took us down there and wanted to show us what respiratory therapy was long ago. And there wasn't no such thing as a respiratory therapist. But polio came and was sweeping across the country. And I don't know how. I've seen pictures of all these people with polio causing them so much paralysis that they can no longer breathe. And they were, I'm sure they didn't have these iron lungs stockpiled, but I can remember, I've seen pictures that are available out there on the internet. Go look up iron lung polio wards, and just dozens of them lined up with people in these iron lungs. And what an iron lung is it's a sealed tube that a body can easily be slipped into. Probably, if I remember right, the actual bed that you lay on is on rails and slides in and out for easy getting access to the patient. And it seals up with only your head sticking out. And then there's this ring where you twist it, and there's this kind of a real silicone-like flexible material that finally seals you around the neck. Not choking you, but and then what happens is, rather than them ventilating by what we do today, and that is, forcing air down into the breathing, your trachea, this is using a negative pressure. So there's a big pump that real quick will suck all that, quite a bit of the air out of the chamber, and this causes the chest to expand, and that person is now inhaling air, and then it the chamber releases that pressure, and then the chest is allowed to go back into a relaxed state, and then another deep breath. And so that just, it's like normal breathing pretty much. Their muscles aren't working, but they're forcing the chest cavity to expand and retract just from controlling the pressure within that chamber. And yeah, I got to ride in one. It's kind of weird, So he says, yeah, this one still works. They had just one or two there, museum pieces. So I get in, and they, crank that down, and of course Speedy was there, and so he says, okay, we're firing you up, so don't breathe. It's going to breathe for you. And it was weird because all of a sudden I'm going, well, I guess I'm breathing, but I'm not. I feel fine. I'm not, purposely taking breath, this machine, and it's barely noticeable. You can barely feel what it's doing to your chest from that negative pressure in the chamber. And then Speedy starts cranking up the speed. Speedy, they call him. Oh, he thinks it's all right. I'm going, okay, I'm feeling like I'm getting a little dizzy and hyperventilating. Okay, so he cranks it down. All in good fun, no harm done. So then there was another piece of antiquity that we pulled out occasionally to use. So at that time, we had the several different ventilators, the Puritan Bennett, the Ohio. They all kind of worked on these bellows systems. A motor would compress this bellows, air would go into a person's lung, and then it would release and let the pressure out, the air exhale. And but the Emerson, it worked like that the same way. But this thing, okay, start off, you look at it. If you were looking at it from a distance, you go, oh, that's a Maytag washing machine, because it had the same dimensions. It's a big metal box, had a little control panel up top where you might say, yeah, I'm going to set the temperature here and I'm going to set it for this many minutes of wash. Okay, but so maybe they were buying the box from Maytag. They put the access door to the internal parts on the side. You open up that green box and you can see, okay, here's what makes it work. There's a big electric motor, just like you would see like on any type of like big electric powered thing. And there was a belt pulley taking it up through to a larger pulley to step down the motor's spinning pretty fast, so you got to step it down so that it's turning this wheel slower. And that wheel is attached to a rod, which is attached to a piston on a little displaced placement, so that it's just like an automobile piston going up and down in this chamber that the piston is in. And then there's some mechanisms for controlling a valve, just like in a car. A valve would close and the other one open, valve open, close, to direct, okay, I want when the piston's going down, it's bringing air into it. Then that one closes, the other one opens, and that's sending the air out to the patient through a tube. And of course, you have to humidify the air. You're putting air into this patient, and you want it warmed and humidified. So setting in there in the corner was a hot plate, just like you would, electric hot plate you might have at home to put your coffee on. And then setting up, and there was a little knob you could set, control the temperature. And here's this glowing hot plate in there. And then on top of that was a pressure cooker. I mean, it was a pressure. It had the handle on it. It had the lid that would lock in. Had the pressure thing that was, had a. I don't know if that was probably was sealed off, because you don't want that going off. But it was like a hodgepodge of kitchen and automotive and just whatever they made this ventilator. And it was a workhorse. We only brought it out if we were short on other supplies. And quite often it was kind of saved for the patient that was really compromised with like a stiff lung fibrosis, like a coronavirus lung. Maybe they need to pull out them Emersons, because when we had a patient with a really fibrotic lung, we'd pull out the Emerson because it was the only one strong enough to really, it's just going to shove that air in there and get that oxygen to them. And gosh, the administration, the director of the respiratory therapy department did not like the man for many reasons. He also was involved with being an instructor for the 2-year registry program, which I was enrolled in while working as a certified respiratory therapist. And him and this other Yahoo over at the St. Bernardine's Catholic Hospital, they were both involved with teaching respiratory therapy program, parts of it. They had no teaching degree, and they had no sense of decency either. These two characters, it was pretty much, word was known that they hated women. They did not want women to pass this respiratory therapy program, and they made every effort they could to see if they could make every woman in that program sometime break down and cry. They were vicious. And the guy at the county hospital, not going to mention names, I mean, they've passed on now, but that's fine. So we're sitting in the break room up in the respiratory therapy area, which is just kind of mainly just old patient rooms that aren't in use. And down the hall is the office for the director of respiratory therapy. And one day we're sitting there in the break room where, we're taking breaks. And, this is where we'll tell some of our own personal stuff or gripe about what's going on or whatever. And I'm looking up at the ceiling, and there's these little holes poked in the ceiling. And I had looked at that before. I'm going, did someone just get bored and poke holes? And I go, I'm curious about those holes up there. So we got a ladder or a chair tall enough or whatever that someone could stand, and they push one of the tiles up and out of the way, and there's a microphone sitting right there, a microphone. And so we get our head up there a little bit further, and it's heading straight to the director's office on that floor. So we kind of sneak over there, check he's not there. Door's unlocked. We open it up. We see this little device on his desk, wire coming down the wall up to the device. You touch it and you can just hear everything that's going on in the break room. So yeah, so he's eavesdropping, paranoid little son of a gun. I guess I'm going to go ahead and spend a little time to tell before I depart from the county hospital and move on to the St. Bernardines, where I'll eventually, take employment. There was one incident where, well, with respiratory therapy, we were in the day of where we had to just make stuff up. They were starting to treat some of these severely diseased respiratory patients with PEEP. What PEEP is peak in expiratory pressure. And so what it was is we would have to rig up, get a tall plastic container, clean, put some water in it, you drop a tube down into it. That's a tube that the patient will be exhaling into. They're more than likely intubated or they have a tracheostomy tube. Then there's an inlet air coming to them that just provides the oxygenation setting that we have. So they would pull freely from that. Then when they inhale, it's like if you put your hand over your mouth and inhale against it, it presents a pressure in the chest. And so we would set however many centimeters of pressure by depending on how deep we put that tube. And it's all very, jimmy jawed together. But you go, okay, where is the the studies that goes to show that we knew that was a thing that worked, but we didn't have an official certified, so we just made this stuff up on the fly, and that's just the way it was done for a while until the really sophisticated ventilators came along that could ventilate, could do CPAP, could do PEEP, all kinds of wizardry. But those were all tested, certified, and blah, blah, blah. So kind of my last period of working there, I started working a lot in the neonatal intensive care unit, and this is going to carry me deeper into overtime, but that's okay. You guys bear with me. This is a good story, kind of. And I enjoyed it. Usually, it was a deal of where you're going down there and you're making sure that a little baby is getting enough oxygen. Maybe that for a little while they'd have to wear a little mask or something, or be in a incubator that has some oxygen and extra oxygen environment. But occasionally we would put a baby on a ventilator, little premature born baby, and we had just one ventilator for doing that. It was the Borns company, and just about the size of a laptop, stand-up computer. And so usually that the way that will work, of course, a tube would either be placed into the nose, into the trachea, or just in the mouth, into the trachea, taped in place. And this is very tiny stuff when we're talking sometimes, 6 and maybe even 4-pound premature infants, and their lungs are not yet fully developed. And so for them to survive, they need supplemental oxygen or maybe even assistance with breathing. So I get called down there, or I'm just working there, and they bring this baby in from the newborn that had just been born in the hospital, very premature. And so I helped to transfer the baby on into the little incubator, and his head was at the end of my top of his head was at the end of my fingers there, and his little legs were hanging over my thumb and here at the knee. That shows you how big that baby was. I can't remember whether it was like 2 or 3 pounds or what. It was small, and I'm going, I don't know that we're going to have success here. So immediately, we're intubating him and putting him on the Borns. It's just these little sips of volume that we set for him, and 20 or 30 breaths per minute, whatever's needed, set the oxygen level, and as the days went on, I can't remember how many weeks, maybe 2 or 3, 4 weeks or so. He's gaining a little weight. They've got nutrition going in, but his oxygen percentage in his blood keeps dropping, and we're having to continuously up the oxygen percentage to maintain a proper oxygen level. And we were having to, increase the pressure that this machine is delivering. His lungs were getting stiff. And I had been for some time building a contraption, experimenting with an idea of scaling down what we did with adult patients, where we had them on these ventilators that would provide um, all kinds of flexibility with pressure, and you could change the flow curve and all. Where this Bourne's, it was like the flow that air came in from that pushing, that piston, it was just this square curve. It was just like, ram, here's your air, here's your air. And, I felt like this is probably causing some of the, damage to the lungs over the period of time. And so I showed the director, who's a guy that I really didn't like, same guy I'm talking about, that showed him this thing that I'd been working on, and it was very simple. Just have first you got your oxygen, you got your air and your oxygen mix. With those two, you can determine how much oxygen we're going to be given. And it's just a continuous flow through this tube. Now we want the baby to be ventilated, and he's not breathing well on his own, enough on his own. So I took a Bird IPPB machine, and all that's going to serve is I'm going to put the usual thing that is the actuating device that would close, and so that it would allow a tube to fill up with pressure. And I put it at, far away from the patient, near the bird, and that I would set the timing on the bird just to control that cycle. So the bird is not ventilating the patient. What's ventilating is just the fact that it's closing. That's all that thing. It's just there to act as a control that speed of the valve to control how frequency the breath would be and how long it would stay closed, give a proper volume. And I had it on it. We have these little test lungs, just these little black bags filled with foam, and the bag would, and so I could set and determine, say, okay, we're getting this much, how many cc's of air going into this test lung, and I let him look at that, and he's said, Mike, I just can't. That's not a registered, certified piece of equipment, and we'd be really sticking our necks out doing something like that. And I said, this, he says, yeah, I know the baby's going to die, but he says, I just don't know, and I don't know what changed his mind in like another day or so. I'm putting in long hours, in the neonatal, and he says, go ahead and, tonight, go ahead and put your machine on there, and we'll monitor and see how it goes. Because the baby was near requiring 100% oxygen on the Bourne's. It had gotten to that point, and so we put it on, and I'm just staying there 24-hour, that first night, and it was just so rapid that the oxygen level started improving in his blood, and we were able to turn the oxygen level down, turn it down, and it's like over a matter of a week, we were able to get him off of the ventilator. But so much damage had been done, just one, he was too premature. We gave it our best shot, but the damage was done, and it was decided that, we'll keep them comfortable. And the parents agreed. There's the doctors explained to him there's so much lung damage that it's he's not going to survive, and so they agreed, let's not extend this any more than necessary. So it wasn't but weeks after that, the Bird Corporation that made that Mark 7 IPPB machine that was so rapidly used just for breathing treatments, they came out with what was called the Baby Bird. And dang, I mean, it had more bells and whistles than my little setup had, but it was slick. It was basically working on the same principle. No piston, just a little constant flow of air through the tube. Close it occasionally and get this nice gradual inhalation, not a slam bam. And so that was cool. Now got to work with a really certified, registered piece of equipment. And I mean, it was good. It was good. But they stole my design. I don't know how they found out, but they stole my design. So lots of fun. All right. Well, dang, 30 minutes. I apologize. So hope you all hung in there for that final bit. And next visit will be to St. Bernardine's. Some tomfoolery going on there. St. Bernardine's Catholic Hospital. Let the fun begin. Bye-bye.